Hey guys, welcome back to the Science of CBD podcast brought to you by Twin Lab. This is a mini series we are featuring with expert product formulator, clinical nutritionist for over 35 years, Carl Germano. Welcome.
Good to be back.
Yes. So we are doing a mini podcast series with Carl, and we are talking all about the endocannabinoid system and really diving deep into some of the science and the specifics that we haven't yet. So this is episode 3. If you guys haven't seen the first 2, definitely check them out on the podcast. All right. So today we're going to talk about the safety of CBD. And we talked a lot about the endocannabinoid system and the CB1 and CB2 receptors and how CBD and other phytocannabinoids act in the body. But I know a ton of people have questions on the safety, and I think that's fair because, you know, this is something kind of new in the last number of months, really,
Sure.
For the masses, I think. And I know a lot of the questions that I get are around safety. And can I take phytocannabinoids every single day? Is it beneficial? Is it healthy? Can I overdose from them? I'm sure you get a lot of the same questions too, but these are some of the questions that we are seeing coming in and some of the ones that I get personally from my friends.
Well, CBD has a pretty long history in medicine. GW Pharmaceuticals actually has 2 drugs that have isolated CBD in it. So they've done a lot of work, and getting approval for these drugs, you have to prove safety. Albeit that those drugs are in the several hundred, maybe even thousands of milligrams in certain conditions. Nevertheless, the safety has been proven. There's been at least 2 very big published studies on the safety of CBD, looking at anywhere from 25 milligrams up to 1,500 milligrams a day to be well tolerated in humans. And so when they looked at a lot of these studies, and most of them hover in the several hundred milligram range, there was no change in physiological functioning, psychological functioning, or any other issues that you typically look at in adverse reactions. Even when chronically administered 1,500 milligrams a day. So we're not looking at acute doses of a high amount, we're looking at a chronic administration of high doses were very well tolerated. I think the only thing that we would be considered important to understand is that people who take very high doses, we notice that CBD has an effect on the Cytochrome P450 system in the liver. This is a system of enzymes that can either speed up or slow down the metabolism of toxins or drugs, so that if people are on prescription medications, CBD may have an effect on either decreasing or increasing its breakdown or metabolism. And so one would have to be aware of that, but that's at very high doses. We've even looked at studies in the 40 milligram range that had no effect on the liver enzymes. So to summarize, CBD is very safe, very well tolerated. There's been several published studies on its efficacy and safety, as well as several published studies on adverse reactions. And it is one of the safest compounds we have out there.
Now, what about taking it or taking a phytocannabinoid supplement every day? Is
In low doses, I see that a full spectrum hemp extract that has CBD in it acts like a multivitamin for the endocannabinoid system. So to me, when I look at what is the foundation program for most people, whether it be a patient, family, or friend, and they say, well, what should I take? Well, a multivitamin, fish oils, a probiotic, and yes, low-dose phytocannabinoids, because we want to nourish and support the body's most important physiological system that controls all others. And so small doses, 5-10 milligrams of a full spectrum hemp product, 5 to 10 milligrams of CBD in there, will act like a multivitamin for the endocannabinoid system. So it can be taken daily.
No, that sounds great. Thank you. Do people ask you about the safety in the product or safety in CBD for children? I know, because especially with the GW pharmaceutical drug for children, is that something that you get into?
I'm cautious about children, and I'm cautious about pregnant and lactating women, because while I can make the case we don't have the data on developing fetus, what happens to any nutrients above and beyond the daily value for pregnant and lactating women, I would be very cautious for that group. As far as children, yes, GW has several good published studies on the use of CBD in children with epilepsy. So does that mean we can try it in every condition? And I would just be cautious. I would just say that this is something you should work with your practitioner about. I know that there are clinicians out there working with children with autism, ADD, and on and on. So I know that it is safe in children under the guidance of a healthcare practitioner.
Thank you for that.
Yeah.
All right, guys, thanks again. Episode 3 with Carl Germano, Science of CBD podcast, brought to you by Twin Lab. We still have so much more, so make sure you tune back again, and we will keep going with Carl. Thanks, guys.